Okay, so we're going to pick up again with our next panel. Thanks.
All righty, thank you very much. I needed that. I appreciate that. So anyway, my name is Ivan Juzang. I'm the founder and president of Me Productions. We're a health communications company that really focuses on really three things in terms of communities that we work in. Primarily, they're oral-based. They come from an oral tradition. Second, their environments have set them up for failure environmentally. And then third, we look to try to develop communications that speaks to their worldview. And so that's what my company does as a strategy to do health intervention campaigns around the country. So I've been asked to moderate the panel of Spartanburg, so I'm looking forward to that. I got a chance to meet some folks last night. I want to start with a quick poem, though. May or may not have anything to do with evaluation, but I always use this poem when I start my communication workshops around the country, which is an old Chinese poem, and I'll just say it. Go to the people, live among them, learn from them, love them. Start with what they know, build on what they have, but of the best leaders, when their job is done, the people will reply, we have done it ourselves. So that's the kind of, theme I'm hoping that we can establish as we try to listen to the Spartanburg community and help them at the end of the process say, we have done it ourselves, right? So with that, I want to just quickly give you the two aims I was given by Bridget and Lee. I appreciate that. So we're going to really try to focus on you guys. One, the key thing is listening to Spartanburg, trying to understand what do communities value, what really matters to them, and then at the end of the day, or the second half, again, starting to design evaluations for what communities value. So quickly, what I'd like to do is have folks introduce themselves. Just so y'all know, this is going to be kind of shortened a little bit, but we're going to get into two sets of questions with the panel after they do introductions. But we're going to leave a little time that if there's some questions y'all want to ask the panel, we can do that as well, and then we'll just wrap up and get to lunch. So with that, we'll just start. Mitch, if you don't mind, down at the end and come this way, right? If you can just say, introduce yourselves, tell us a little bit about yourself, but at the end of it, kind of just answer this question quickly, if everyone can remember this, what really matters to you in terms of Spartanburg? And then that may help us start the process. Then I'll get into the questions.
Mitch Kennedy, I'm the Director of Community Services for the City of Spartanburg. I'm a Spartanburg guy, born and raised, grew up there in what I refer to as the center city of our community. I enjoy getting up each and every day, being part of the solution to move our community forward as I oversee and administer community development, parks and recreation, and community relation aspects for our city. What matters to me is our babies, which are our future.
Thank you. Very good. Renee?
I'm Renee Romberger. I work at Spartanburg Regional Healthcare System. I'm a 30-year hospital administrator who dove off the deep end, according to my husband, 5 years ago and quit my comfy job in hospital operations to go chase this thing called community health. And I did it because I met some really cool people who are sitting at this table and people in the community who said, you know what, the hospital's got to get in the game. You guys are not doing anything to help really improve the community. And if you care about health, you got to get to know us and you got to start working with us. And so I literally quit my job and went from a division of 1,000 people to a division of one me. And now I have lots of people in my department, so to speak, but they're all community people. So I don't have anybody inside the hospital, but a whole lot of people in the community who are much smarter than we ever were. I tell people today that hospitals think they're the center of the healthcare wheel, and we're really not. We're one spoke. And we're actually a very sad spoke because we represent everything that's wrong with the public health system. And so if you want to know what's wrong in your community, go to the hospital and see who's there. And if you want to do something about it, then take those issues that are driving them into your hospital and figure out how to keep them out of your hospital. And so I really personally am driven by that passion right now, not only to help be a partner in Spartanburg, but also to try hospitals to get this whole thing of community health. Because it's not about community benefit or giving back. It is really about, if you want to be a successful hospital, you have to have a community health strategy and you have to be a partner.
I'm Tony Thomas, Northside Voyager and president of the Neighborhood Association. I've been a resident in the neighborhood for 23 years, and what's important to me is that we have an all-inclusive community that's healthy. We take care of our elderly, we take care of our children, and we have the respect of other communities around the Spartanburg area.
Hi, I'm Regina Stevens, and I'm actually the outreach coordinator for teen services at the Point Teen Health Center in Spartanburg, which is a part of our health clinic, our DHEC area, so our local health department. What I do in the community, I do focus on teenagers in terms of teenage pregnancy prevention, STD, HIV, things of that nature. But to me, it's basically just kind of an overall scope of health, for our teenagers, and just definitely engaging them on, what's important and why they need to, pretty much build their self-worth and take care of themselves in terms of, the overall goal of health connections. I also, I'm a board member, and I'm involved in different advisory boards in the community. And what's important to me, because prior to working for public health, I actually was a manager in retail. And so that actually taught me the difference between management and leadership. And so it's important to me to, just spread my knowledge and my passion to the community, to use it especially because they're often overlooked at times, to teach them to be advocates for themselves and whatever they're passionate about, so that way they can go around and spread the knowledge as well, because it's an overall cycle and what we need to do. So that's my goal.
I'm Kathleen Brady. I work at the University of South Carolina Upstate campus that's located in Spartanburg County. I do have a public health background, but part of what I do is measure the community on a number of factors, and the community predicates its funding decisions based on data in Spartanburg. So it is my great joy to work with all of these folks and learn lots every day about the community. And one thing I've learned is that Spartanburg is not a fabulous place to live for everybody in the community. And that's where I hope we can get. It is a fabulous place for us to live, but we want to move everybody in the community to that position.
My name is John Stockwell. I've lived all over the country, but never any place longer than 6 or 7 years until I moved to Spartanburg, and we've been there for 20 years now. And I was chancellor of the university for 17 of those years, and retired a couple of years ago. One of the great things I did was hire Kathleen as director of our Metropolitan Studies Institute. But having said that, I thought often and all the time, really, about baccalaureate degree achievement, because that was sort of the arena I worked in. I retired, and we were concentrating with a 501c3 on how to increase baccalaureate degree achievement, and we quickly decided we were missing the point. It is school readiness, and then third grade reading and eighth grade math, and so on through the sequence. And the group that we work with is really focused on a culture change across Spartanburg County that values academic achievement, in contrast to what was required in a textile economy a few years ago. And I believe, with regard to a healthy community, that academic achievement and health are intensely iterative processes. Education, it predisposes healthy behavior, and vice versa. And we've sort of stumbled into a collective impact model in our Spartanburg academic movement, we called it, and the idea of a collective impact model in health and wellness is exciting to me, and to be partners with colleagues here at the table and many, many, many others in Spartanburg is really rewarding.
Thanks, everyone. So we got two aims we're going to try to get to, you guys, in a few minutes. So I just need y'all to kind of be open. Whoever has the feeling can take the question. But the two aims, just for the audience to know, and they're actually, I think, written up in your agenda, is we want to uncover a few things the community wants to change. That's a kind of a macro broad one, so there's a lot of things you could say there. But then, so that we can get to some specifics, we also want to come up with one or two. The second aim would be to come up with one or two specific ideas or things the community would do if you guys had $1 million over 5 years. So let's start with the broader one first, and let's look at it this way. If you had the power to change things, so we can get to what you'd want to change, what would your community look like in 10 years? If you had the power to change things, whoever wants to answer this, what would your community look like in 10 years?
I'll start with that. I would like to, in 10 years from now, I would like to see my community a place, if I had $1 million, a place where there's safe, adequate housing for people to have. I would like to see education at the top of the list, starting with the children from childhood to college. I would also like to see it safe. I would like to see a community that's safe, that where the issues of crime are being dealt with in an effective way by the police officers that serve us, and just an overall atmosphere where other people won't have a problem coming into our community and being a part of it. That's what I would like to see in 10 years.
Let's get one or two more. Mitch, you want to go?
Interconnected neighborhoods. We have a very diverse community, but we're not connected. One of the most segregated times in our community is Sunday, church. How can we kind of connect the dots? I was thinking the other day, within our city, we have a lot of amenities within our community, parks and gatherings, but the promotion of building those relationships and people coming together don't exist.
So in 10 years, what would you want to happen in that regard?
I would like to see greater diversity with where people live, where people fellowship, as far as their religious affiliations, their choices of housing, and where they go to school. I want to see a diverse community. I want to see a community that looks much like this room that we have here today, to integrate all aspects of our community. We have a diverse community as it relates to the population. The African American community is the majority by a small percentage, but you see such segregation today in where we go to school, where we play, where we fellowship, and I, in 10 years, would like to see us know each other better, appreciate each other better, because I think that ultimately will be the driving force behind a sustainable community.
Okay, let me. Before, we're going to get to you, Renee. So I know you got some, but Mitch, let me just probe a little bit more. So what do you think would get in the way of that vision?
Some of the we like to say in South Carolina, some of those good old boy thinkings, those old school politics are barriers. Some of the old policies are some of that. And we also have lack of trust. Some of the things that we discussed out there, the apathy that we see are barriers to success in building that beloved community, so to speak. So those are some of the most pressing barriers.
Yeah, I like that. It reminds me that when you think about some major movements, even in the United States, it wasn't the community that changed, it was mainstream America that changed, right? So to think about how do you get to those old boy values in terms of that change as well. Renee, what would you like to see in 10 years?
So Mitch talked about a segregated community. I think we're living in a world of segregated healthcare, and I think it is a huge problem for us in Spartanburg. I'd love to see our community as a place.
Can you give me an example of segregated health? Just expand just so we know.
So if you've got 2 or 3 chronic conditions, you go to 2 or 3 or 4 different doctors, and those doctors don't talk to each other, and you try to figure out what it all means, and you try to put it all together, and none of us are capable of that. I don't care what degree you have or what your background is. I've been in hospital administration 30 years, and yet when my family went through a crisis, we found it very difficult to maneuver through the healthcare system or to understand our bill or to all the questions that you have, we all have them. It's not based on income or anything else. We've got a very segregated healthcare system, and if we're going to do a better job of caring for people, we've got to interconnect the healthcare piece, but then even more importantly, we've got to wrap around it with that whole social determinant piece. So probably in 10 years, I would love to have a community where you have a community health worker or a care navigator on every corner. And so no matter who you are or what you are, if you have needs, you can go to somebody and say, you know what, here's the issue I'm having, can you help me? And I'll give you an example. We had someone shadow the probation office. Esther knows that we're fascinated with law enforcement and detention centers and jails and probation, because as hospitals, those people are very critical to us, because if we don't work together, people are bouncing from jail to ER to community with behavioral health issues. So she was shadowing at the probation office, and as she was watching these people come in and talk to their probation officer, they would sit down and the individual would say, how are you doing today? And they would say, oh my gosh, you don't believe, I'm going to lose my house next week. They're going to take my house away and I really don't know what to do, and yada yada. And she was observing this, and she wasn't supposed to be saying anything, and the probation officer would say, well, I'm sorry, but have you checked in with your law enforcement person? And so after she watched that for the course of the day, she said to him, gosh, there's so many things I want to say and do to help these people, and why aren't you helping them? They've got these social needs, and we have a lot of resources in the community. And the probation officer said, I don't know about those resources. We're way understaffed. I've got a caseload of 85 people, and my job is to just make sure they're checking in with their law enforcement person. So there's an issue that's going on in the community that if we had a community health worker sitting in that room with the probation officer, they could be connecting them to resources that are going to prevent that guy from having to go out and steal again in 2 weeks because he lost his house and he doesn't have a job and he doesn't know where he's going to get his food from. So we've got to start being smarter in our community about understanding that separate agencies really aren't separate, and we've got to start working together.
That's very good. The whole notion of environment setting folks up for failure, right? Yeah. Very punitive environments these communities sometimes live in. All right, one more, and then we're going to shift to the $1 million question. Anyone want to, John, what would you like to see in 10 years?
I'd like to see every child ready to learn when they go to kindergarten. Every child ready to learn when they go to kindergarten. Every child reading well by 3rd grade. Every child having a foundation in math in the 8th grade that facilitates advanced math and science and technology and so on in high school. Every child graduating from high school and headed into some post-secondary achievement.
Let me get you to go in a little bit further, because we know that those key indicators, particularly for folks who work in the schoolhouse prison pipeline, right? We know that those are key indicators for folks who are going to go to the criminal justice system. But what make it more personal about what does that mean to you in terms of Spartanburg? What does it mean to you in terms of what you want to see the community be like in 10 years?
Well, I think, I look at the school, the elementary school in the heart of the Northside initiative project that Tony was talking about. 5 years ago, it was a scary place. Now it's an extraordinary place where 6th grade girl will come up and shake your hand and say, let me show you around my school. Parents are coming into the school with regularity. They're focusing on leadership. They may not get the guidance about going to college when they go home, but they're taking that guidance home because the expectations are being built in the elementary and primary and second and middle school years, that post-secondary achievement is not only important and essential, it's very, very possible. So we're seeing children become the thought leaders in households about academic achievement. I see Cleveland. I'd like to see that replicated across Spartanburg County.
All right, let's shift with the amount of time we have. This is very good, you guys. I appreciate it. So, Regina, Kathleen, got to get you guys. Let me start you off with this next question. You have. Let me just make sure I get it right. 1 or 2 specific ideas of things the community would do if they had $1 million over 5 years. You know what I mean? Tell us what you think.
I'm not sure how specific I can get on this, but I think what I would like to do is see us sort of facilitate a widespread understanding of what determines health and what determines a healthy community. And I can give you a specific example from my world. Sometimes they make me teach at USC Upstate, and I teach nurses, RNs to BSN. So these are folks who have been in healthcare systems for a long time sometimes. And one of the things I ask them is, what determines health? What determines health outcomes? And almost 100% of the time they say, well, if the person follows what the doctor says, exercises, and eats right, that's it, they're done. And they talk about non-compliance and things like that. But then when we start, really examining the built environment and other kinds of issues, light bulbs suddenly go on with these folks. And it always amazes me that people who work in the healthcare industry don't know what determines health. And I think I would really, really like to have some initiative so that we can wrap our arms around the wider issue.
Excellent. Regina?
I would say I would like to see a lot more hands-on, approach in terms of healthcare and really spreading knowledge of why healthcare is important. Because with me, I believe it starts with, of course, the environment in the home. And of course, we all can't change exactly what's going on in the home, but if we, raise the awareness of education or take the existing programs that, already exist in Spartanburg County as far as certain nonprofit organization, the Boys and Girls Club, Big Brothers, Big Sisters program. You have your, girls group home, boys group home, things like that. So taking programs, even the health department, just in the hospital systems, of course, and the Northside initiative, just taking the programs, like I said, that's already existed and really formulate just kind of an outreach approach to someone who get hands-on in the community and like really talking about this, really being seen and just really saturating areas that needs this information. So, that's something I would like to see, just because, of course, it happens a lot internally as well, in just teaching and training the healthcare workers in terms of the approach of the community when they're accessing the services. But at the same time, seeing some of these community workers outside, so getting out of the office, as we spoke about before, because I, for one, as an outreach coordinator, I don't want to be in my office. A lot of people ask me, we never see you in here. I'm like, because I'm outreach, so I can't do my job sitting in the office. So I go over and above, just the call of duty in terms of, doing outreach as far as vendor style events, handing out pamphlets. I don't like to do that because the pamphlets end up in the trash can. So me speaking about it, or me actually having different, groups or conversations. In the conversations it's simply like this, we all sit down. It's not lecture or anything or teachy or even PowerPoints. We have a discussion and I actually, listen to them and what they feel like they need to know in terms of change and what they need to do to better themselves. So just like I said, just really getting out there and just kind of putting your face out there in the community and just having more people that's really passionate about it, because, we can all clock in and out for a job, but actually having a program or resources you come into and you can tell the difference between if a person liked their job or not. Mm-hmm. So instead of being just that instructional, hey, can I help you today, or whatever, just really, showing that person that you're engaged with them and you actually care and it matters that you're coming here to seek services. So and an example is the Point Teen Health Center, and the only thing I see that's really different and what sets us apart in terms of just going to the main health department or any other healthcare facility is that, all of our nurses and myself as an admin that work out there 2 days a week, we care and we take it over and above just them coming in for services. Yeah, we give them birth control. Yeah, we do testing as well, but we actually ask them about, how are your school, what are you going to do in life, what are your goals, things like that. So we actually engage in conversation, so we build that family type set in that relationship mm-hmm. with them. Mm-hmm. And they come back. Mm-hmm. And our young people are a voice in the community, so they are our best advertisement. So if they actually connect with us and they actually see, great services, they're going to come back and they're going to tell their friends about it. So it's pretty much an ongoing trend. So
just so y'all know, Regina is actually talking to me in coded language, which is I'm oral based. Pamphlets don't work, which is a literate based culture going into an oral based community. She's developing relationships, right?
Right.
And she's making sure the community is making informed choices. I always say in communities where the environment has set you up for failure, young people aren't making bad choices, they're making uninformed choices. They've only been taught 2 bad ways to do something, so you have to figure out how to get them different information to make different choices. Doesn't mean they're going to change their behavior immediately, but because she's building trust in a relationship, she's going to be the person they're going to go back to when those issues arise. So that's really excellent to hear her frame it that way. So go ahead, Mitch, and then we got one more question I got to ask you, which is a part of this one, and then we're gonna wrap up.
So when you think about investment, I'm thinking about this group that's gathered here in the effort to bring this group together.
Right.
And you think about if you sustain this type of effort over 5 years, how powerful it could be and the difference that you could make. I mean, just coming here today, I've met somebody that went to my same high school that I didn't know, went to the same university I went, and a colleague of somebody who's moving to Spartanburg within the next 6 weeks. By just bringing this group together. So you think about if you, over a 5-year period, you sustain that type of relationship building in a community, the deliberative dialogue type of session, and just some of the barriers and the walls that you could break down, and some of the efforts that could come out of that type of process.
Oh, absolutely.
You know, so when I think of an investment of $1 million over 5 years, that's how I would invest my dollars.
No, that's excellent. And again, the notion that, you know, again, they're talking in coded language, but it's important to frame this, which is communities right now that particularly I work in don't trust institutions. They're trying to rebuild trust, right? They're trying to reconnect, right, to institutions that are supposed to be providing services that the community doesn't trust. I'm convinced that trust is a mental health issue that's not discussed enough, but that's what these guys are trying to do, is rebuild trust. So I really appreciate that. One last question.
Hey, Ivan?
Yes.
Sorry just to interrupt, but why don't we go till noon or so? Just because I think it'd be nice to dig in a little even deeper to like specific things about
So have folks
Spartanburg.
ask a question?
Or no, I'm just saying you take the panel till noon or so, just so we can dig a little deeper.
Oh, we can get a
into
little bit more time.
Spartanburg
All
and like
right,
the tangible
perfect.
things
Hey.
going on. And, yeah.
Okay, so let's here's what I wanted to ask about this, because you guys got some good thoughts. Who needs to be at the table with you guys? Who needs to be what community members would you call on to help you do this? Community members, institutions, stakeholders. I mean, I know you guys are here and y'all represent, but who else would you guys want or need to be at the table to help you with this? Kathleen, you're nodding. You got something there?
Oh, so much. Policymakers, they're not at the table, and by that I mean the political policymakers.
Right.
You all, of course, know YRBS, the Youth Risk Behavior Factor, blah, blah, blah. So we can't get those data in Spartanburg because our political leaders have decided that our children shouldn't be exposed to YRBS in schools because of one question: have you had sex? Now, we all know that these high school students have never thought it before, and if you ask the question, they'll suddenly think it and run right out and do it. Well, it's amazing to me that we cannot gauge risky behavior in our community, so we can't do anything about it. So those folks are missing from the table.
So let me just be real frank. I mean, because I don't know if it was Tony or Mitch mentioned. I mean, how do we get the good old boys to the table? Is that what we're kind of talking about a little bit here when we say the, you know, different groups? How do we do that? I mean, how are you guys going to approach that issue? Because you could do a lot of work, but if the politics, the environment, the funding streams, the way things work, you know, we're going to have to address the elephant in the room at some point, right?
So that's one of the things that I think we've been doing.
Okay.
When we got on this teen pregnancy issue, and Kathleen brings up, I mean, we absolutely would not talk about pregnancy, because if we talked about it, children would, lo and behold, get pregnant. And so we didn't talk about it, and all of a sudden somebody from the state came and said, you know, you've got the highest teen pregnancy rate in the state. Don't know how that's happening, but somehow we end up with this high teen pregnancy rate. And really what broke the cycle for us is the joint funders in our community, 4 foundations, came together and said, I think we ought to do something about this, so why don't we pool our dollars together and see if we can collectively tackle this issue. And so when the joint funders decided to fund that issue, in the 5 years since that funding's happened, we've seen, what, Regina, 35% reduction in teen pregnancy rate in Spartanburg County. And I think what it's taught us is if we care about an issue and we get together on it, we can do something about it. And so now the joint funders have stepped to an even riskier topic, and that is behavioral health. We had one foundation in particular that said, I really don't want to be a part of that discussion. That really doesn't affect us. That's not part of our mission. But they begrudgingly agreed to $5,000, each of them, to fund a study in our community to look at what is the behavioral health problem in our community and what are we going to do about it. From that study, we've created a task force. It's being led by the United Way of all agencies. The Department of Mental Health's involved, alcohol and drug abuse is involved, hospitals involved, your typical partners. But then you have other partners like the jail, like folks from the school system who see it every day. And those people have come together and said, here's what's happening in our community because we're refusing to talk about this issue. And so we are hitting home runs right now really on some behavioral health things in our community because we've decided that we can talk about it beyond whether it's part of our primary responsibility.
Okay. I'm going to get to questions from the group, but one last thing I was just thinking about. I mean, it really sounds fascinating, but I'm always wondering, because you guys talk about community involvement, community engagement, buy-in for a process, they're involved. How are y'all going to manage the expectations? Because, you know, once you start engaging the community, then they have expectations. How are you going to manage those expectations that increase, but making sure you don't overpromise if you really ultimately may not be? So it's just one of those things that I think is not always discussed. You want to involve, but at the same time you want to be sensitive. You want to create high expectations, but then you want to figure out how your demand that you're going to generate, you know, there's a supply there. Have you all thought about that, or?
Go ahead. I would like to say, as far as expectations are concerned, with this initiative, what we all talked about at this table and all the partners that are involved is that we be up front,
right.
We be face forward with what we're doing. Don't promise things that we can't deliver on, and to be candid with people about where they are and what goals and what expectations they can expect, what they can look forward to. It's incumbent upon us to keep our word, you know, that to the community, because like I said, they're waiting to see what we're doing. They're waiting, and they're, as the Voyagers, which is what I am, a member of one member of 8 people, a group of 8. It's incumbent upon us to relate to the community the ideas that our partners are trying to put forward. You don't want a stranger coming into your community telling you anything, but if you hear from someone, a neighbor like myself, or someone that's in your community, it's easier. Right. So it's our job not to, you know, elaborate or you know, promise too much.
Right.
Our job is to be precise, get the information from our partners, and share with the community.
Right.
And we can always ask the community, what would you like to see? You know, what's ideal for you? But it's our job to make sure that we keep it real. Good. And that we don't overpromise anything.
Who has a burning question for the panel? Anyone? Oh my goodness. Yes. Thank you. Say your name real quick, just so
Sure. My name is Deepthi with Thicket. And my question is around inclusion, because I think that Spartanburg and the other Way to Wellville communities, one of the really interesting things is that it's communities of around 100,000. And at that level, you could imagine getting every single person in the community involved in this effort. And can you imagine a way in which everyone is able to get a voice and able to participate, kind of in the way that you were just describing your own role?
I think we've started that process somewhat. These individuals are cheerleaders or champions, so to speak, but we have several other individuals in our community that are champions to this cause and other causes that are just, they are building those relationships, meeting people where they are. You know, that's the key. You know, oftentimes I enjoy coming here to Washington, D.C. to have this discussion. But I also appreciated the fact that the group from the Hiccup and Way to Wellville came to our community and met us and really understood where we were. And you have to do that throughout your communities. You got to meet people where they are. I remember a time when I was relatively young, where people would often ask me, so Mitch, what do the black people feel about this? What is the black community? And I used to answer it ignorantly, thought I had the answer. Then I realized, I was like, I don't know. I live on the east side, you know. I don't live on the south side. So, you know, building those relationships and telling your story, being open and honest. That was something that was said earlier. I forgot who noted it. Talks about those things that matter in community and those things that bring communities together, whether it's good or bad. Well, our community was a mill town, okay? Spartanburg was a mill town. And as a mill town that also concentrated all of its public housing within its city limits. Those two factors have such negative effects on us today. Our educational attainment. There was not an aspiration to get a baccalaureate degree. You didn't have to have a baccalaureate degree to go to the mill. So, I mean, in the concentration of poverty, of public housing, and what it has done to us. So it's important for us to really have real talk about those decisions, but then have champions and others that really understand that process and what it takes to get there. That, it's not, one or two people making these decisions, that we are educating people in a systematic way of where we come from and what it has done to us today, but the process and the things that we have to do to reach that mountaintop. I was the one that was in that mountain group. You have the ability to see where you're going, but you also must look back to where you have come from, because that's important. Because that in itself, having that discussions, will break down some of those trust issues. And that's what really unites a community, that they can rally behind a process like Way to Wellville. And it becomes something that defines us, that we can get excited about. We have that process with our effort, our Northside initiative that we have going. There's not a person in our community that does not know about the Northside initiative, because we've taken time to really educate people about what it is, okay? I mean, we talk about the criminal elements, that it has the highest concentration of crime and the prostitution that exists. We don't pretend that this stuff is not taking place. It's important that you have this type of discussion. So that is important, and that's how you really rally people, because they want you to talk about those things. They don't want you to ignore those issues.
Okay, go ahead, and then we got a question over here.
Okay, with what Mitch said about the housing authority and building those houses in the city, what we have in Northside is we have a situation where we have two housing authority complexes right across the street from each other, which in effect has created poverty, a big congestion of poverty right there in that area. So what our challenge is to deal with the poverty issue, but at the same time, respect the dignity of those people that live there and offer them the opportunity to be in the community that they've lived in for 20, 30 years or more. And that's the challenge, because it worked back in the 40s and 50s when they wanted to give better housing to people, move them out of the county, no running water, no facilities, no toilet facilities. But now, that's a problem for us now, because it's creating congestions of poverty all over, not just in Spartanburg, but all over the country. And so what we're having to do is we're having to deal with the human element and say, okay, now how do we move these people out or change their environment, change their situation without displacing them? So that's the big challenge that we have. And I think the initiative, and I'm always going to speak from the point of view from my neighborhood and the Northside initiative, is that our partners have came in and decided to work with us and change our environment and change our situations and not do it to us. A lot of times they come in and with a plan and they say, this is what we're going to do. And the people don't have any input. But with us, we have input. We have a say. And that's important for creating a healthy environment and a situation where the rest of the community will respect this community, because we took the initiative to do it. No one came in and said, we're going to do this to you. We're going to do this with you. And that's very important. And that's how we should do it all around this country, because what worked 50 years ago is not working today.
Okay. State your name real quick, if you don't mind.
Hi. Oh, do you want to go?
No.
Sorry.
Yeah.
I'm Lauren Taylor. And Tony, I was wondering if you could just tell us a little bit more about the Voyagers, because it came up a few times. I got to speak to Mitch before, and it sounds like a really key vehicle of community engagement, but I don't have a really clear picture of what it is. So how did you get involved? When did it start? Is it full-time, part-time, volunteer? Tell me more.
I'll answer that as succinctly as I can.
Please.
It's a lot of stuff, but I'll try to be brief. But it started for me about 7 years ago. I saw a need in my community that we didn't have food. We didn't have a grocery store within 2 miles. and it was a problem. We had ice cream trucks running around all day, coming in and out of the community, selling ice cream, no discount tickets to the dentist. So we were like, we need healthy food here. We got enough ice cream trucks running around here. So we got together and we said, okay, what are we gonna do? I donned the broccoli suit. We had a couple other people don some banana suits and things, and we got on TV. And then as a result, we joined up with Partners for Active Living, and the farmers market came up with a mobile market with fresh vegetables and fruit that come through our neighborhood just like the ice cream trucks do. And for those who received EBT or SNAP benefits, they were going to get double the benefits if they used it. So that created an opportunity for us to have fresh fruits and vegetables in our community where we didn't have it before, because we weren't able to sustain a 45,000 square foot BI-Lo or a Food Line or something like, or Walmart. So with the Voyagers, how the Voyagers came about was after that initiative worked so well, we had bicycles we would rent out to the community because we wanted people to exercise. We have a high rate of diabetes and heart disease in our community. So we wanted people to get, start exercising. So we rented bikes out. You could rent a bike for $5. When you return it, you get your $5 back. So that gave people the incentive to exercise and get out. And from that, we decided that with this initiative, we needed the people to come. We needed somebody in the community that was going to be a liaison between the corporate people and the community. And that was us. And we were trained. Stan Davis, who's a noted community leadership counselor, he came in. I understand y'all paid him a lot of money to come in, but he trained us for 8 months. We attended several workshops, including out in Sacramento, California, with choice neighborhoods and purpose-built communities, and that's how it came about. And it's 7 of us, and we went through extensive training just so that we could be a liaison to help this transition, because it was going to happen, it was going to take place. And it's free, I'm not paid to do it. It was born out of my desire to see a better community, and the other people in the community who felt the same way. Now, that may change in the future, but for now, it's free, and it's just a labor of love for me. So that's how it came about. And I think it's a model that other people should follow, because it's well worth it. The crime rate in my community has just dropped. I mean, it's just simply dropped. All of the interlopers, I think some of you have heard me say that before, and our community is elderly people pretty much. And the ones that are left that own their homes, other than the homes that have been, boarded up and closed, the rest of the houses that are left are pretty much owned by the people who live there. So we had to say, okay, we got to address the situation. So we wanted to make sure that there were people in the community that was working with and talking to and dealing with the Mary Black Foundation, Spartanburg Regional, the Milliken Foundation, Wofford College, Edward Villa School of Osteopathic Medicine. We wanted to make sure that there were people in the community that the people in the community could have access to. We have block captains in each corner of my community that has information. People in the community can come to us and ask us about things concerning the initiative if they want to know, if they have concerns. And it's providing a smooth transition, if I will, to the people, so that they don't feel invaded or they don't feel like this isn't about them, because it's all about them.
10 seconds. Yeah. We do not have, the city, we don't facilitate neighborhood meetings. They do. We will have a meeting with the Voyagers. They facilitate the meetings when they might call on Mitch Kennedy to present, but they clearly understand whether it's a challenge or opportunity, they're the one conveying that to the neighborhood.
That's excellent. All right, we got time for, you got a question or you want to point to someone? All right, come on, who has a question? I thought we had one over here. You want to, you got to get to a mic, they're going to get mad at you.
Denise Stevens, Matrix Public Health Solutions. One of my questions was just answered, but I do have another one about the panel in general. How cohesive and connected would you say you are? Were you connected and cohesive before this initiative? And how are you going to maintain and ensure that your leadership and cohesiveness and connectivity, if it's there, continues?
So I think what you will see, and I hope Rick would tell you or Esther would tell you when they came to see us in Spartanburg, we're not folks who got invited to Washington and don't really care about each other's work outside of this initiative. We've been doing this for 5 years, and when you ask the question of what would we do with $1 million, probably the first thing we would say is it's not about money. It is about relationships. And what we've built in Spartanburg is a foundation of relationships and a level of trust that is so significant that there's not any one of us, and it's a much bigger team than the people we have here, but there's not any one of us that would do anything to jeopardize the work that's being done or letting somebody down. I would do anything in the world not to let Mitch Kennedy down because I trust him. He's like family to me, and I hope he feels the same way. And we've just got a camaraderie and a relationship that we've built over time. And I think for us, the most important thing is we built that before we started chasing a project. And I think that's the biggest mistake that people make across this country. And I say this in all due respect to foundations who offer grants and dollars out there to people. It encourages people to chase a project. And if you don't know each other and love each other and care about each other, you're never going to be successful. And we see it fail all the time in other communities. There's a program called Access Health. Some folks in this room know about it, but Access Health Spartanburg was the first program in the state. And they wanted to replicate it, and so they took it to other communities. And then the Duke Endowment said, wait a minute, I want to put a pause on this because somehow it's not working so well. And I think what ended up happening is you had other people saying, we want what they had. Yeah, we'll go after that money. It's $250,000. We'll do that because I'm sure we've got access problems in our community. And they forgot to build the relationships. And it never works if you don't really know and care about each other. And I think that's what we've got that's sustainable. And with the Way to Wellville project, we all looked at each other with that project and said, you know what, if we don't get it, it really doesn't matter. We've come up with some cool new ideas for this project, and we're going to do them anyway. Don't go pick another community, Rick, but you know, it's not about chasing the project. It's about we want our community to be better. We're all vested in it, and we're going to do it no matter what.
If I could add, I mean, I believe pound for pound, nobody does partnership like we do. I mean, when I think of projects that we pulled off in our city, I can't think of one that there wasn't a partnership. And that partnership is also, to Renee's point, is accountability. I'll give you a quick example. The Mary Black Foundation, which really is the driving force behind our Way to Wellville effort, partnered with us to build a community center. Well, one of their program officers was in one of my community centers and saw 150 kids participate in the summer playground program. But they also noticed in the trash can a bunch of potato chip wrappers and things. They took a picture of it and sent it. It's like, what is this? What are you going to do about this? Don't you know I responded immediately? Let's sit down and talk about it. You know, there's got to be an effort. But that's the accountability aspect of it. And that happens all the time. You know, we hold each other accountable, and that's sustainable.
One last question, you guys, for lunch. Don't make that put any pressure on you. Okay, go ahead, yes.
Hi, so my name is Vera Zuransky, and I work for Vitality Institute, and I'm actually working on a Robert Wood Johnson grant to make the business case for employer-led community health investments. I was wondering if you are engaging local businesses, and if so, if you could talk a little bit about that.
Anyone?
Yeah, without question we are. There are certainly, pardon me? No. I think on all of the initiatives that we're talking about, there are businesses engaged, not just financially, but in terms of personal support and investment. One of the things we've stopped doing in Spartanburg is telling the old stories. And we just step on people who tell the old stories about how bad schools are or this, that, and the other. One of the stories I like to step on is a good old boy story. That's an old story. We don't have good old boys in Spartanburg. We elect them all and send them to the legislature, so they're down in Columbia. You know, in my district, I had to make a decision about whether I was going to vote for Mr. Venal or Mr. Stupid, and I voted for Mr. Stupid, and he's down in Columbia. The people left in Spartanburg do the work. They really do, and it's true of our city's leadership. It's true of our I think our county leadership. We have 7 school boards in Spartanburg County. I have not, in the years I've been there, 20, seen an internecine warfare on any of those school boards. I look at county-wide school boards elsewhere, and I see incredible angst and hostility. We just don't, we just don't put up with it. We'll get in and step on the old stories and tell the new ones.
Okay, real quick.
But in all, let me just, to be honest and frank, I mean, we have very successful business leaders who are very caring about their community, and they have invested in many of these initiatives. I would say it's more, y'all disagree with me, I would say it's more individual. It's not the name of the company that's going out leading the effort. Milliken's not driving community change. So I hear Robert Wood Johnson. I think I talked with her earlier about employers, but I would say that we are not an employer-driven coalition. Maybe we should be. Maybe we can learn more from you, but that's not what's driving it in our community.
Okay.
Good or bad.
All right, one last question, Lee.
I just have a question for maybe Regina or Tony. If you could just tell one surprising story that happened during your work with someone you talked with in the community, so something they want that surprised you or something they wanted to change that surprised you.
Something that surprised you guys, story from the community.
Well, I have a lot of stories from my community. People are surprised. First of all, a lot of people in my community wasn't sure. You know, they looked at me as a lot of naysayers. They was like, "This isn't going to work. I don't believe you." 2 years ago, you know, they said this is going to work. But they started to see changes in our community, you know, and they started to see that the things that the Voyagers were bringing to them were true. You know, a lot of times, like I said earlier, people in South Carolina and other places, they come in the community, do things without the people, and the people don't have an idea or clue what's going to happen. They just wait to see where the ball is going to fall. But with us, you know, we told people ahead of time. We had the foresight to say, okay, I can come to you and tell you what's going to happen. And one incident, a lady came to me and she said, well, I don't know. Y'all will never do anything for the elderly around here. You don't do anything for us. So I said, okay, we'll work out something for you. What would you like to see? You know, she said, the elderly people need to come together and meet. I want to play bingo. You know, I don't know my neighbors anymore. So we did that. We was like, that's not an issue. You know, that's not something. It's about communicating. It's about you knowing your neighbor. You know, a lot of times in our community, because of the crime and the violence that happens, you know, people tend to close off and they tend to get to themselves. So what was easy for me to do was to open that door for them and say, you don't have to be like that anymore. You know, we're all a community. We have to take ownership and charge of it. So now we got the bingo going on for the elderly in the community. You know, and she's like, this is great. That's all I needed. You know, you know, I can do bingo in the daytime and I come home and knit, you know, but I'm happy. So sometimes it's the little things, you know, and before it wasn't that, you know. We said, well, why didn't they have those kind of things? Because the community felt under siege. They felt like all the crime, all of the craziness going on around them, I'll just go in my house and lock the door. So we had to open the doors again. We had to open it back up. And that's what I'm hearing from my residents and, well, my cohabitants, is they're coming out and saying, thank you. You know, I can walk my street. I don't feel bad about walking down the street. And that's to some people might not seem much, but that's a big deal when you're talking about the community that we're dealing with. So it's a good thing. And that's one of the surprising things for me, is that she felt that she didn't have no voice, and she didn't have no way of bringing people in her community together. She had neighbors who all felt the same way she did, but they didn't know how to do it. So when we said, okay, you have a team now that's going to work with you, it made a difference.
So John, Kathleen, Regina, Tony, Renee, Mitch, thank you guys very much. And we got to get to lunch, so we really appreciate y'all sharing with us.